I'm Esther, I'm 12 years old and I've been a part of this trial. I'm allergic to peanuts and I've been in this study for around about 6 years now.
The National Institute for Health and Care Research, NIHR, has awarded the NIHR Manchester Clinical Research Facility, CRF, £15.5 million from 2022 to 2027 to enable opportunities for people of all ages and backgrounds across Greater Manchester to take part in research. Hosted by Manchester University NHS Foundation Trust in partnership with the Christie NHS Foundation Trust and the Northern Care Alliance NHS Foundation Trust, Manchester CRF is the largest and most comprehensive of the 28 NIHR clinical research facilities.
Life expectancy in Greater Manchester is amongst the lowest in England and is strongly linked to levels of deprivation. That's why it's so important that we have the NIHR Manchester Clinical Research Facility, dedicated to enabling cutting-edge experimental medicine and clinical research across a diverse range of clinical areas that meets the needs of our local communities. We deliver this in collaboration with a variety of partners that share our vision and ethos and are dedicated to patient and public involvement in research. We provide dedicated and specialist buildings, equipment and laboratories for experimental research and work with patients, hospitals, universities, charities and industry to take the best new ideas from science to create treatments and tests, to treat illnesses and help people to live better lives. We bring this together under our NIHR Manchester CRF leadership, which includes internationally recognised clinicians and scientists from across Greater Manchester, supported by a multidisciplinary team of research support experts. We are proud to be a key partner within the Greater Manchester, North West and national research and innovation infrastructure, growing experimental medicine across each of these areas. This includes hosting the UK CRF network, which brings together all CRFs from the UK and Ireland and develops, shares and implements excellence in efficient and effective research trial delivery, coupled with excellent patient experience and safety. The aims of the NIHR Manchester Clinical Research Facility are: 1. Expand our facilities in response to the clinical needs of Greater Manchester's population and the needs of the national life sciences industry. 2. Increase the skills and capabilities of our research workforce and the next generation of researchers through tailored training and education programmes. And finally, 3. Involve our research participants, patients and local communities in the co-production of our systems and processes to ensure engagement and widen opportunities to access experimental studies.
Manchester CRF's unique integrated multi-site framework approach to early phase clinical research means most people are no more than 30 minutes away from a clinical research study taking place in Greater Manchester. Under a single overarching management structure, we operate 6 world-class facilities based at NHS teaching hospitals across Greater Manchester: the Christie Hospital, Manchester Royal Infirmary, North Manchester General Hospital, Royal Manchester Children's Hospital, Salford Royal Hospital, Wythenshawe Hospital. Each site is managed locally in a proven and highly effective system, allowing us to rapidly deliver a broad range of high-quality experimental medicine studies for both adults and children in paediatrics, respiratory medicine, rheumatic diseases and cancer, alongside important opportunities for research in neuroscience, mental health, dermatology, metabolic and infectious diseases.
Across Manchester CRF, we provide 24-hour, 7-day-a-week inpatient and outpatient research services, with more than 50 research beds and over 20 outpatient consultation rooms throughout Greater Manchester. Our clinical research facilities provide a safe environment where research interventions and treatments for conditions including cancer, rare genetic or neurological disorders, and respiratory conditions can take place right in the heart of a hospital campus. Active collaboration across our Greater Manchester sites enables our researchers to easily access the specialist equipment in the dedicated space required to deliver a diverse range of early phase clinical studies. Our facilities include a specialist paediatric audiology suite, cardiopulmonary exercise testing capabilities, a physiology lab for adults and children, and dedicated MR scanners, as well as on-site laboratories for complex sample processing, preparation and storage. By consolidating our research assets across our clinical research facilities, this allows us to explore new and novel ways to drive efficiencies and maximise the impact of our research across Greater Manchester to deliver more experimental medicine studies and increase accessibility of our research for local people of all ages, ethnicities and backgrounds.
We know that to improve the health of the population and reduce health inequalities, we need to empower people to take part in inclusive research. And our priority is making sure everyone in our communities are equally represented in the research that we do.
It's been a really good experience to open up a lot of other opportunities for me, like travelling or going around with my friends, and it's just been a really good helpful to understand what my body does when I'm having an allergic reaction. It's nice that I can be a really big help in the fact that other children don't have to go through that struggle of worry, and obviously the parents don't have to either, because the trial has really, really helped. Because there's another 16 people on the trial as well as me, it's good to know that I'm not doing it on my own.